Welcome everybody. Today we'll be discussing the elbow joint. Just quickly right here. It's one of my favorite topics because it's involving three main bones of the arm. Um, of course, as you all know, it is a synovial hinge joint. Hinge joint means that my arm, it allows the motion of um such, okay, the flexion and extension. And around this joint, we can also see some proximal and distal joints that I'll be discussing later on. Just to start with, the articular surfaces of this joint, it involves the trochlea and the capitulum. As you know, if you've studied the structure of the humerus, it has a capitulum and the trochlea. Okay, and the trochlea of the humerus articulates with the trochlear notch of the ulna. So the ulna has a trochlear notch that articulates with the trochlea of the humerus, and the capitulum articulates with the head of the radius. So this is the capitulum and articulates with this head of the radius. Okay, and these are the main articular surfaces. It's between three main bones of the arm. Uh, Also, as you guys also know from the previous video, that there's a a capsule that surrounds the joint to help make stabilization for the joint. And here we have a fibrous capsule. Um, it is thin in front and behind. It allows for flexion and extension, as you guys know, the movements that I just mentioned a bit, and it's thick on the sides to prevent abduction and adduction. So it prevents the those type of movements because we don't want the elbow joint to be in a way flexed. So your arm is like that. You don't want it to flex this way or that way because it will really hurt you, and that's why it's not friendly to move the joint through abduction or adduction. Okay. And attachments, let's see. So it is attached to the front of the humerus, just above the um, coronoid and radial fossa, and to the roots of the medial and lateral epicondyle of the humerus. Um, and posteriorly, it is attached to the back of the humerus, just above the olecranon fossa. So you have to make sure that you know that above the trochlea, okay, there is the conoid fossa, and above the radius, there's the radial fossa. And why those fossas are important is because when you flex your arm, this is when those processes or parts of the ulnar and radius join or articulate with the fossas right here. So you have the conoid coronoid process of the ulna. When it's flexed, the coronoid process of the ulna enters the coronoid fossa above the trochlea. Okay, and when the um, arm is also flexed, the radial part right here articulates with the radial fossa above the capitulum. Okay, and then on the posterior end, when you flex your arm like that, what stops it from going further is that the olecranon process, which is right here of the radius of the ulna, articulates on the posterior aspect with the olecranon fossa. So if you go and study the structure of the humerus, you will see that on the posterior end, you will see that there is an olecranon fossa, and that's for the articulation of the olecranon process with that fossa. Okay. There's also synovial membrane. It, you can read more about it right here. Didn't pay attention to this so much because when you mentioned those things that I've just mentioned, plus the ligaments that I'm going to talk about right now, you'll be fine for this joint. Secondly, the ligaments, very important. He loves to listen what the ligaments are. As every hinge joint, the LB joint is supported by two strong collateral ligaments. So every hinge joint that you're going to be studying in the body, there's always going to be collateral ligaments. And those ligaments extend one, two. Okay, so it's on the sides always of your elbow joint. You have two, the radial collateral on the lateral side, lateral side, and the ulnar collateral on the medial side, right here. So you will see those right here. Um, this is look. So the radial collateral ligament. Um, it is a strong triangular ligament on the lateral side of the joint. So you have to always, when you say lateral, it's on this part right here. Okay. Um, it is attached to lateral epicondyle. You need to know. So that's why it's important to study the humerus structures. You have to know what the lateral epicondyle is. So the lateral epicondyle is right here. Okay, attached to lateral epicondyle and attached to the annular ligament below. So what is the annular ligament? If you so that's a good drawing of the head of the radius. The annular ligament just attaches around the head of the radius. So you'll find from the lateral epicondyle, and then it will attach and be uh, fused with the annular ligaments on the head of the radius. Okay, I would advise you to go and look on even more clear pictures. But if you're looking at this image right here, it is the right arm, and that's the humerus. So we're looking at the lateral side of the right arm, and then it's attached to the annular ligament of the radius. So right arm lateral side, ligament comes on from here to here. That's the black part right there. That's called the radial collateral ligament. The ulnar collateral ligament. The ulnar collateral ligament on the other side, it'll be attached. We're also looking at the right arm medial end right here. It is a strong and triangular ligament on the medial side of the joint. It is attached to the medial epicondyle. This is the part right here. I don't know if you ever felt this, but sometimes you get hit on this part and it really hurts your arm because there's a nerve that is surrounding this region. So it's attached to the medial epicondyle, okay, and it extends from the medial epicondyle to the medial border of the coronoid process of the ulna. Okay, so you have from the medial epicondyle to the medial side of the coronoid process of the ulna. And you need to just imagine how that is. That's the coronoid process. It'll be somewhere here on the medial end of the coronoid process, okay? That's the anterior border. Now, the posterior border, it extends from the medial epicondyle to the medial margin of the olecranon process. And that's going to be probably on the um, posterior aspect of your elbow. So it'll be from the medial epicondyle to the what is it called? The medial margin of the olecranon process. So the olecranon process is found on the posterior end of your arm, medial epicondyle to the olecranon process, and the lower border extends from the coronoid process to the olecranon process. And that will be quite easy to imagine if you really know the process or the structure of the ulna. Okay, so that's it. You don't need to really dive into the specifics, but you just have to know that there's the radial collateral ligament and the ulnar collateral ligament, and the ulnar collateral ligament is triangular, just like the radial collateral ligament, and you can see it right here. Okay, that's the um, yeah, that's the ulnar collateral ligament. All right, next we're gonna talk about the. Okay, I don't want to be maybe mentioning those things yet. Yes, so you have brachialis muscles, nerves right here. You will be studying all of those in the future, but just concentrate on the most important parts right now. Um, we're just going to dive into the movements of the joints, as I said, flexion and extension. So the flexion mainly by the muscles that are found on this part, which is the brachial, the biceps and the brachialis that allow flexion. Okay, and the opposite part you have the triceps muscle that allow for extension of this joint. Okay. What's next? So you also have the radio-ulnar joints, and those joints. Okay, I don't want to dive into this because it's not part of the elbow joint. We're basically done with the elbow joint, but these joints that are mentioned right here are probably important for you to know exactly what causes the supination and pronation movements of the forearm. Okay, they are the superior radial ulnar joint. Sorry. Okay, they are the superior radial ulnar joint or the proximal radial ulnar joint that are found here between the radius and the ulna, or the distal radial ulnar joint that are found between the radius and the ulna. And there's more about it here. Maybe I'll create a video if you guys are really interested in them. Um, yeah, it'll be a good idea to create a video. But that's for the elbow joint. You have to know the ligaments. You have to know what articulates with what. You have to know the bones involved. You have to know what type of joint it is, the types of movements, and maybe the capsule that surrounds it. So this is the end of this video. Thank you guys for tuning in. I'll be posting next the wrist joint.